Yes, I am Dr. Small Lane. I'm a board certified OB-GYN and a true believer that all women deserve high quality care. And I believe that both in a professional sense as well as a personal sense. So while I am an expert on fibroids and endometriosis, and I've done extensive fellowship training in minimally invasive gynecologic surgery, what really fuels me is the opportunity to be able to take care of women who are in the shoes that I once was, because I was once that woman with fibroids, with fibroid symptoms needing treatment. My People sometimes ask me that, and I think about it like my first memories of having periods. None of my memories of having periods were good. I remember being young and having pain and feeling nauseous and vomiting on the playground. That's like one of my earliest memories of having periods. Unlike some women, like I didn't have painful periods every single month. It was kind of smooth sailing right until university. And looking back, there's like little inklings that things weren't quite right. And unfortunately, a lot of those things were normalized within my family and friend group, which happens to a lot of people. So I went to donate blood at the Red Cross, and they took a little sample, like a little pinprick from my finger, and they dropped the blood into this container. And then the nurse said, and then she brought me into the small room, and nobody likes to go into the small room. So, of course, I'm like, oh my gosh, I have Ebola. And they brought me into the small room to tell me that I have Ebola. And I didn't. It turns out I had anemia, not Ebola. And I was so happy to be anemic. And she gave me a paper of the different foods that I need to eat to bring up my iron levels. But what didn't happen at that point was an investigation as to why I had low iron. And what I didn't know then, and I wouldn't know for many years, is that I had years of heavy bleeding with my periods, which is why I was anemic, which is why I couldn't donate blood that day. By the time I made it through university and got into medical school, kind of the heavy bleeding had creeped up on me. I knew it was heavier than usual. I knew I was doing things that other people weren't doing. So I would have extra pads, extra tampons with me wherever I went. At school, I had like a little kit of things in case my period came on and it was heavier than expected, which isn't things that normal or other women had to deal with. And then I started having more severe pain with my periods. And the pain really started to preoccupy my thinking. It was always, when can I take the next ibuprofen to be able to handle the pain that I was having? And when I would tell people about my periods, they would say, everybody has painful periods. Periods hurt, they have crampings. You take these medications and things get better. My period is like that. Everyone's period is like that. And there's just a day where I remember this totally. I would get these sharp pains through my pelvis that felt like someone was like cutting me from my belly button through my rectum. And I would just be immobilized with pain. And I would have this like metallic taste in my mouth, like my whole body would change when I was on my period. And I was just on the bathroom floor, just immobilized with this sharp pain. And I said, I can't do this anymore. Like, there's no way that other people have periods like this. I'm like, I don't know what this is. It's probably endometriosis. I'm in medical school. I've read through the textbooks. I've read the symptoms. I know what endometriosis is. I have the pain that they are describing. I have endometriosis. I need to go find a gynecologist. So I found a gynecologist, walked into her office, announced to her that I have endometriosis. And she's like, oh, okay, so you're from the medical school. Like, yes, I am from the medical school. I have endometriosis. I have all these symptoms. And she's like, we need to do an exam. So she did an exam and she said, you have fibroids. So I had fibroids then that were big enough that she could feel them on exam. So from there, she then referred me to another gynecologist who was actually a REI doctor, so a reproductive endocrinologist, infertility specialist, who also specialized in doing minimally invasive surgery. And he was able to help me with a myomectomy, so a procedure to remove my fibroids. And after I had my fibroids removed, um, like my symptoms vanished. All of that was gone. Like that strange metallic taste, the nausea, the sharp stabbing pains, the heavy bleeding, it all went away overnight. So I had my first fibroid surgery just days after my 25th birthday. So I was very, very young at that time. And it didn't stop there. Eventually, the bleeding started to slowly pick up, and I knew what was happening. I knew that fibroids were back. I knew the symptoms of fibroids. I knew what I had, and I didn't want another surgery. Like my plan was that my next surgery was going to be a C-section to deliver my baby. So I was doing everything that I could to hold off on having a surgery because I didn't want to have another procedure. So it was different medications. So it was a combination of different medications that I would take when I was out of my period. It was that same pack that I had in medical school with extra pads, extra tampons. And if you could imagine, I was an OB-GYN resident at this time. So I would be running around labor and delivery with like 2 pads in my back pocket in case I needed to change my pad while I was still on the go. That way I could see a patient, run to the bathroom, change, and then keep going. And it was this insane way of living that is really familiar to a lot of women that deal with fibroids and heavy bleeding. It's just kind of this constant adapting your life around your period and around your flow. So when I have patients coming to me now, the questions that I ask them, it makes their eyes light up because they feel like I've been reading their diary because I've actually lived their diary with the questions that I ask. So I ask, do you wake up in the middle of the night to change your pad? Do you sleep on a towel? You said you wear a tampon. Is that one tampon or is that 2 tampons? And these are the types of questions that other OB-GYNs may not know to ask and may not know that people are doing just to make it through the day. My fibroid story actually then kind of interacts with a whole fertility experience as well. There is an intersection between fibroids and infertility or subfertility, definitely with pregnancy complications. So because I had surgery on my uterus, the scar on my uterus that was left behind wasn't as strong as the rest of my uterus. And this is something that I knew going in, which is why I knew I was going to have a C-section for delivery of my baby. And we were diagnosed with infertility, which was a combination of both within me. We thought maybe it's related to this new growth of fibroids. Also with my husband, because he had male factor infertility, some issues with his semen. Long story short, we did like all the IUIs. We did 6 rounds of IUIs, and then we went on and we did IVF. And we finally got pregnant with IVF. It was the first time I had ever seen a positive pregnancy test, which I was over the moon. It was like, oh my gosh, I can get pregnant. And that pregnancy ended in miscarriage. I had an early miscarriage when we were just under 6 weeks along. So we hadn't even gotten to the point where you could see an embryo on ultrasound. And it was pretty devastating for us. We had already been trying for almost 2 years at this time, and this was kind of the first time that we thought that it was actually going to happen. So we regrouped. I had another surgery that I was putting off to remove more fibroids, just trying to give the best chance possible, thinking if maybe fibroids had contributed to us having a miscarriage. After having the fibroid surgery and recovering for the amount of time that you're supposed to recover for, we had an embryo transfer. And again, I became pregnant. And again, we're over the moon, but a little bit cautious because of what happened before. We'd already been here. We'd already been pregnant. We made it 5.5 weeks before things ended. So we were cautiously optimistic, but also not getting our hopes up, not really sharing it with anybody because we didn't want to then have to basically unshare that information. So we kept it to ourselves and we trucked along, knew that we were pregnant, but it, in certain ways, it just didn't feel real. Somewhere along the line, I think around 16 to 18 weeks is when we were really like, my goodness, we are pregnant. This is happening. We have to start making our preparations. We have to start telling people we've done absolutely nothing. We don't have a baby registry. We have done not a single thing relating to this pregnancy. And a couple weeks after that is when I started feeling the baby kicking, which really made it real. I'm like, I can't ignore this now. It's inside me. It's moving. It's happening. But about a week later is when things ended. So I was teaching a class. So I was a fellow now. This is during my surgical training. And I was teaching a class on how to do hysterectomy to training OB-GYNs. And I felt this sharp pain and nausea in my pelvis. Didn't know what was going on, but I knew something was wrong. I just like couldn't lift up my head, felt really sick. And if anyone knows people in the medical profession, so nurses, doctors, we have to be at death's door before we go to the hospital. And I felt like I was there. So I let another doctor take me to the hospital. One of my co-fellows drove me to the hospital. Weren't sure exactly what was going on. I was admitted for 3 days before we knew that my uterus was rupturing. So one of those scars on my uterus had started to open. Basically, it started to unzip, and I was bleeding internally. And the plan at that time was to try to keep me pregnant as long as possible. And kind of that was one plan that I was hearing, but also with my medical expertise, having been in this world, having had these conversations, understanding what it's like to have a baby that's going to be born somewhere around 22 weeks to maybe 23 weeks, knowing that it's not going to end well. Like I've had those conversations with people about what to do, what it looks like, and I had to have that hard conversation with my husband that, you know, someone's going to come into this room and they're going to make us make decisions about what to do if our baby's born today, tomorrow, next week, and what that looks like. We never had to make those decisions because day 4 of the hospitalization, that's when I started bleeding like externally. It was coming through my vagina. Hopefully, I'm allowed to say vagina on your podcast because I'm an OB-GYN and those are my normal words. But I was having blood coming out of my vagina and it was 3 a.m. I woke up my husband. I'm like, this is it. I'm like, this is it. Like I have to go to surgery. I called the nurse who called one of my OB-GYNs. This is also one of my mentors who came to the hospital, who mobilized a whole team unbeknownst to me. Well, I called my parents who were across the country. I was living in Las Vegas. They live in New Jersey. And I called my parents then. So if this is 3 a.m. In Las Vegas, it's midnight in New Jersey. And I'm waking them up and I'm saying, I'm going into surgery. And I don't know exactly what I said at that time, but my parents said that it sounded final, that it sounded like I was saying my last goodbyes. So when they got off the phone with me, they booked plane flights right away to come to Las Vegas. I got wheeled into surgery, and I remember feeling cold and dizzy and fuzzy. I remember being in the operating room. I remember seeing familiar faces because these are the surgeons that are training me. I remember praying. I remember saying a prayer that a pastor had shared with me that's normally spoken at funerals, but he explained that it is a prayer for people who are living and who want to live. So, yea, though I walk through the valley of the shadow of death, I shall fear no evil because I know that you're with me. And these are the last thoughts that I'm having before I go to sleep. And then I wake up and I'm surrounded by light. I see my husband's face. He's looking at me. He's smiling. And then I'm just becoming more aware of my surroundings. I realize that I am still intubated. There's a breathing tube. There are lines everywhere in each of my arms, in my neck. And I just know by the amount of stuff around that it was a battle for my life. I didn't know then, but I know now that I had received 12 units of blood transfusion, that not only did I have a uterine rupture, but I had a condition called a placenta accreta. So my uterus was growing into the muscle, the placenta was growing into the muscle of my uterus. So they were kind of fused as one. So they did a C-section. They took out our daughter. Our daughter was too young to save. But because of how the placenta was growing into my uterus, they also had to remove my entire uterus. So I had a hysterectomy. So it really changed the course of my entire life. Sometimes I share with people, that fibroids changed my life. Fibroids took my fertility, or when I tell people, like, I totally understand all the terrible things that can happen with fibroids. They don't necessarily understand like what the weight of those words are. Like, I know fibroids at a level that I hope nobody ever has to know about them. And it's what makes me so passionate about this topic, so passionate about women's healthcare, about prevention, about good surgical technique, about early diagnosis, about all of these sorts of topics. And it's also kind of what led me to be a mother in a way that I didn't know that I would ever become a mother, because 4 years after that, my daughter, who is living, was born. So I was able to become a mom through a gestational carrier. So after I lost my uterus, we still had embryos left over, and we were able to transfer an embryo to another woman who was able to carry our pregnancy and deliver our dream. So the other part of me, the other part that I'm super passionate about, is gestational surrogacy and the impact that has on people's lives. That's something that both my husband and I share. So we created a startup which is designed to help intended parents, both those through infertility, who have medical conditions that make pregnancy unsafe, same-sex male couples, to be able to make it through that process in a way that is easier, more cost-effective, and faster. That way they can become the parents that they know that they want to be. So that is kind of the long story about fibroids, what it has meant to me, a little bit about my fertility story, what brought me to surrogacy, how I became a mother, and how this makes Dr. Small Lane who she is and why she loves to do what she does. I don't know why there isn't more information about this, especially when you think about the prevalence of fibroids. So most women have a fibroid. At least 70% of women have at least one fibroid by the age of 50 or 60. So for something that is so common, not to have these types of answers is actually kind of shocking. We don't know 100% what the connection is between fibroids and fertility. And depending on the study you look at, it says that there isn't a connection, actually, that fibroids don't cause infertility or fibroids aren't associated with subfertility. We know for sure they are associated with poorer pregnancy outcomes. So, miscarriage, second trimester loss, babies that are born too small, that don't grow, that aren't head down, kind of like a slew of different bad pregnancy outcomes, but we don't have great data that says that they cause infertility. However, anecdotally, there does seem to be a link between fibroids and infertility. We have seen things where if there is a fibroid on the inside part of the uterus, so if you picture a uterus like an avocado, you have the green fleshy part that you eat, which is like the muscle of the uterus, and then you have the pit, the seed on the inside. If you have a fibroid in that location or pressing on that location, that can make it more difficult to become pregnant. Just like anything inside the uterus can make it more difficult to become pregnant. Think like an IUD. It's sitting right there, and its job is to prevent a pregnancy from happening. So things in the uterus can stop you from becoming pregnant. But there is some newer evidence to say that maybe just having fibroids in general, a uterus that makes fibroids may have a different kind of protein or molecular makeup that makes it more difficult for pregnancy. And this is like still research that's coming out. What to think about the fact that most women have fibroids, especially when I just shared my fibroid story about all of the tragic things that can happen if you have a fibroid. So should you freak out if you are told that you have one? So fibroids are really common, and most of the time they are small and in a location where they aren't causing an issue. So if you're thinking about the avocado and you have like that kind of bumpy skin on the outside, you can have a small fibroid that's just kind of sitting on the outside, or you can have one that's kind of hanging off like a dog's ear. Those don't tend to affect pregnancy, fertility, pregnancy outcomes, cause bleeding, or a lot of pain type symptoms. So it's really a factor of the size of the fibroid, the location, and the number of them. So while most people have fibroids, most will never know that they have one because they're not causing an issue. Most women don't have any symptoms of having a fibroid. So what makes some fibroids big and what makes some fibroids small? That is still something that is being pieced out. What I usually tell patients is, and this is something that kind of comes up in surgical consultations when I say that we may or may not be able to remove all fibroids and we may or may not need to remove all fibroids. I usually tell people that fibroids tend to have like their own fibroid destiny. So there is some fibroids that are just destined to be 1 centimeter. Some of them are destined to be 5 or 15 centimeters. And we don't know ahead of time which fibroid is one that's going to grow or which is one that's going to shrink. Because sometimes fibroids grow and sometimes they shrink. They tend to have a life cycle. There is more research being done now in terms of imaging, using things like MRI to try to look at specific fibroids and identify which ones are going to be in a growth phase and which ones aren't. That way, doctors and surgeons can target those ones for treatment, either removal or some other kind of treatment. So if you find that you're dealing with a challenging diagnosis, whether that be fibroids, infertility, or facing down surrogacy, just know that there is a way. There is an option, a path for you to be able to move forward. And one of those keys is kind of building your community, building your tribe or your support group, your experts who are going to be able to support and guide you through.